Hey guys, how you doing? So, you guys are gonna study with me because I have an exam tomorrow. Oh my god! So, yeah, this is what we studying, and I'm gonna be doing some reading because I'm gonna be playing this back in my vehicle tomorrow in the morning. And then I got things to show you guys. You guys see the Amazon package? That's my soap that I finally got. Anyway. Asepsis is the absence of illness producing microorganisms. Hand hygiene is a primary behavior. Medical asepsis refer to the use of precise practices to reduce the number, growth, and spread of microorganisms. Clean technique. It applies to administering oral medication, managing nasal gastric tubes, providing personal hygiene, and performing many other nursing tasks. Surgical asepsis refers to the use of precise practices to eliminate all microorganisms from an object or area and prevent contamination. Sterile technique. It applies to parenteral medication administration, insertion of urinary catheters, surgical procedures, sterile dressing changes, and many other common nursing procedures. Before beginning any task or procedure that requires aseptic technique, healthcare team members must check for latex allergies. Must check for latex allergies. That's something I think I may forget, so gotta repeat it. To check for latex allergies. If the client or any other member of the team has a latex allergy, the team must use latex-free gloves. Okay. Equipment and supplies. Most facilities use non-latex nitrile gloves. However, it is the healthcare team's responsibility to identify latex allergies and use items that are latex-free. Practices that promote medical asepsis. Hand hygiene. Always use hand hygiene. Wash hands with an antimicrobial or plain soap and water. Using alcohol-based products, gels, foams, and rinses, or performing a surgical scrub. These three essential components of hand washing are the following: soap, running water, friction. Excuse me, guys, I'm reading through my phone. All healthcare personnel must perform hand hygiene. Hold on, let me clean the screen. Voila Magic. Either with an alcohol-based product or with soap and water, before and after every client contact and after removing gloves. When hands are visibly soiled, after contact with body fluids, before eating, and after using the restroom. Wash them with a non-antimicrobial or antimicrobial soap and water. It is also important for clients and visitors to practice hand hygiene. Wash your hands. Perform hand hygiene using recommended antiseptic solutions when caring for clients who are immunocompromised or have infections with multi-drug resistant or extremely virulent microorganisms. Perform hand hygiene after contact with anything in clients' rooms and after touching any contaminated items, whether or not gloves were worn, and before putting gloves on and after taking them off. Performing hand hygiene might be necessary between tasks and procedures on the same client to prevent cross-contamination of different body sites. So even though it's the same person, you don't want to cross-contaminate. Touching a wound on the leg and then going back up, brushing their teeth or something like that. So change the gloves. Wash hands with soap and warm water. Rub hands together vigorously and rinse under running water. Wash for at least 15 seconds to remove transient flora, up to 2 minutes when hands are more soiled. After washing, dry hands with a clean paper towel before turning off the faucet. If the sink does not have foot or knee pedals for turning off the water, use a dry, clean paper towel to turn off the faucets. For hand hygiene with an alcohol-based product, usually 3 to 5 milliliters in the palm of the hand. Rub hands together vigorously, remembering to cover all surfaces of both hands. Fingers continue to rub until both hands are completely dry. Additional personal hygiene measures. Emphasize the importance of covering the mouth and nose when coughing or sneezing. using and disposing of facial tissues, and performing hand hygiene to prevent spraying and spreading droplet infections. Encourage clients and visitors to practice respiratory hygiene and cough etiquette. Coughing in your elbow. Ensure spatial separation of 3 feet from those with a cough, or have them wear a mask. I'm going to repeat that. Ensure spatial separation of 3 feet from those with a cough. Keyword 3 feet from those with a cough, or have them wear a mask. Wash hair frequently and keep it short or pull back to prevent contamination of the care area or the clients. Keep natural nails short and clean and free of nail gels and acrylic nails. The area around and under the nails can harbor microorganisms. Remove jewelry from hands and wrists to facilitate hand disinfection. Protective clothing. Use masks, gloves, gowns, and protective eyewear to help control the contact and spread of microorganisms to staff and clients. Physical environment. Additional examples of practices that reduce the growth and spread of microorganisms are changing linens daily, cleaning floors and bedside stands, and separating clean from contaminated materials. Do not place items on the floor, even soiled laundry. The floor is grossly contaminated. Do not shake linens because doing so can spread microorganisms in the air. Keep soiled items from touching clothing. Clean the least soiled areas first to prevent moving more contaminants into the cleaner areas. Use plastic bags for moist soiled items, following facility protocol for bag selection. To prevent further contaminations of items or of individuals handling the soiled items, put all soiled items directly into the appropriate receptacle to avoid handling soiled items more than once. Place all laboratory specimens in a biohazard containers or bags for transport and disposal. Pour any liquids used for client care directly into the drain and avoid splattering to prevent spreading droplets. Empty body fluids at water level of toilet to avoid splashing, like going real close to the water and poured it in. Okay. Practices that maintain a sterile field. Prolonged exposure to airborne microorganisms can make sterile items non-sterile. Avoid coughing, sneezing, and talking directly over a sterile field. Advise clients to avoid sudden movements, refrain from touching supplies, drapes, or the nurse's gloves and gown, and avoid coughing, sneezing, or talking over a sterile field. Only sterile items can be in a sterile field. The outer wrappings and 1-inch edges of packaging that contains sterile items are not sterile. I'm going to repeat that. The outer wrappings and 1-inch edges of packaging that contains sterile items are not sterile. The inner surface of the sterile drape or kit, except for that 1-inch border around the edges, is the sterile field to which other sterile items can be added. To position the fill on the table surface, grasp the 1-inch border before donning sterile gloves. To position the field on the table surface, grasp the 1-inch border before donning the sterile gloves. Discard any object that comes into contact with the 1-inch border. Touch sterile materials only with sterile gloves. Consider any object held below the waist or above the chest to be contaminated. I'm going to repeat that because we focused on below the waist. You really talk about above the chest. Consider any object held below the waist or above the chest contaminated. Sterile materials can touch other sterile surfaces or materials. However, contact with non-sterile materials at any time contaminates a sterile area, no matter how short the contact. Microbes can move by gravity from non-sterile item to sterile item. Do not reach across or above a sterile field. Do not turn your back on a sterile field. Hold items to add to a sterile field at a minimum of 6 inches above the sterile field. Gotta repeat that. Hold items to add to a sterile field at a minimum of 6 inches above the field. When it comes to numbers, I need to repeat that because I'll get them confused. I'm like, oh, it's 3 inches, it's 3 feet. So, minimum of 6 inches above a sterile field for it to remain sterile. So, yeah, I'm going to go with my little pictures. Okay, so this is like a catheter box. So, the orange is like the inside of the box. So, I put a little thing. So, the outside of the box and this little one, this represents 1 inch, is not sterile. And then the inside with the oranges is sterile. And I even color coded it with the highlighting over here. And then this, in my mind, as I was reading, because I was talking about drapes. So let's say this is the bedside table, and then they have a drape over the bedside table. So you see the little fringe right here, that's it hanging off the sides. And then we got the 1 inch area right here that is not sterile, and then the orange is the sterile field. And anything within there must be sterile, and if you put anything that's not sterile within the sterile field, it is now contaminated, and you got to start all over again. And then down here, y'all, I got a little abdomen, chest, little something that I drew. So, you know, got a little 6-pack of, you know, one of these days. Like, I'm like, I don't know, but, you know. Then we got a little chest. So, above the chest, I got the little arrow above the abdomen. So, the abdomen sterile. Above the abdomen, it's contaminated. And then below the abdomen, the waist, is also contaminated. So, we got the arrows. I'm pointing down. And then, y'all, this is what I don't like, okay? This is what I don't like. Sometimes I'll be like, what? When they be using words like this. Any sterile, non-waterproof wrapper. I'm like, non-waterproof? What is that? God fucking, like, come on, man. So, I literally Googled, what is the opposite of non-waterproof? Or what? Whatever, what's non-waterproof? Because, I mean, what's the opposite of waterproof? Because this is crap. It's absorptive. I said, why'd you just say that? Why didn't you just say that, man? Non-waterproof? That's a little too extra for me. That confused. Like, I'd be like, especially like you got the anxiety of taking the test, and you're like, non-waterproof. Okay, waterproof. But then, so then you gotta say non means not waterproof. But it's like, why don't you just say absorb? You know, something that absorbs, whatever. So, I put that there because I was like, listen. Attribute that to my stroke. I don't know, but I can't. Wrapper that comes in contact with moisture becomes non-sterile. Here we go. Non-sterile. Okay. By a wicking action. You know, like a tissue, like a Kleenex that's absorptive. And it wicks. So if you put tissue, say there was a tiny dot, and you stuck the tissue there, it would, you would think that it would just be that tiny dot. No, it would spread and it would get bigger. And it wicks, you know, like a candle. Okay, let's see. That allows microbes to travel rapidly from one non-sterile surface to the sterile surface. Keep all surfaces dry. Discard any sterile packages that are torn, punctured, or wet. Yeah, ladies, if y'all go in the little area where the sterile packages are and you see it's torn, wet, whatever, don't just say, oh no, I'm not going to use that one, and put it back. Throw it away. Okay, let's see. Nursing interventions, equipment. Select the clean area above waist level in the client's environment. Clean area above waist level in the client's environment. Well, a bedside stand adjust, so you could adjust it to whatever level usually, to set up the sterile field. Check that all sterile packages, additional dressing, sterile bowl. Yeah, I had to Google what the heck is a sterile bowl, because I'm thinking like one of them aluminum bowls that they put in the autoclave or something. No, it's like a little plastic bowl that is in a, package. Sterile gloves and solution are dry and intact and have a future expiration date. That's important that it has a future expiration date. So my whole thing is, I'm assuming it has to have an expiration date, period, and emphasis on future versus past expiration date. Any chemical tape must show the appropriate color change. I might have to look that up too. Make sure an appropriate waste receptacle is nearby. Procedure: perform hand hygiene, sterile field setup, open the covering of the package per the manufacturer's directions, slipping the package into the center of the workspace with the top flap of the wrapper opening away from the body. So you say it's wrapped up like a Christmas present, you go that way first, and then you take your right hand, go to right, left hand to the left, and then take the other hand, pull it towards you. And you pull it towards yourself last, because that way you ensure while it's still wrapped up, you're not reaching over it to pull it back towards you. Of which, anyway, it's wrapped that way anyway. So there's kind of no way around it. I mean, I guess if you got to pull it that way, you got to turn it so that that's going that way. Alrighty. Grasp the tip. Unfold. Next, open the side flaps using the right hand for the right flap and the left hand for the left flap. Grasp the last flap and turn it down toward the body. Additional sterile packages. Open next to the sterile field by holding the bottom edge with one hand and pulling back on the top flap with the other hand. So guys, I had to watch a couple YouTube videos to just ensure, and also with the donning the sterile gloves, because when it said cuff, I was like, wait a minute, ain't the cuff folded up? Isn't the glove folded up creating a cuff? So I was like, but aren't you contaminating the sterile field by doing that? Nah, it ain't the cuff you think it is. So I watched the video and I got clarification. Let's see. Next, open the side flaps using the right hand for the grasp the last flap, turn it down toward the body. Additional sterile packages. Place the packages that will be used last furthest from the sterile field. Open these first. Add them directly to the sterile field. Lift the package from the dry surface, holding a 15 centimeters, 6 inches above the sterile field. Remember, hold items to add to a sterile field at a minimum of 6 inches above the field. Okay? So right here, 6 inches above the sterile field, pulling the two surfaces apart and dropping it onto the sterile field. Pour sterile solutions. Remove the bottle cap. Place the bottle cap face up on a clean, non-sterile surface. Hold the bottle with the label in the palm of the hand so that the solution does not run down the label. So guys, this pouring of the sterile solutions, you're going to do this before, this all is not happening within the sterile field, okay? Because the solution is not sterile. The solution inside is sterile, but the bottle itself on the outside is not sterile. Okay. Let's see. Hold. First, pour a small amount, 1 to 2 milliliters of the solution into an available receptacle. So this reminds me of when I used to work in a hair salon and we do relaxers. You do not. You actually put less than what you need, because then you got to go back and get some more, so you don't cross-contaminating by or waste product by, some people did this and you're not supposed to do it, but if you put too much, people think you can just dump the used product back in the container. You cannot, because it is contaminated. You dip the brush on the hair and the scalp, and then now you're putting it back in the thing. So same concept here. Use a little bit at a time, and if you need more, get more later. Let's see. Pour the solution without splashing onto the dressing or site without touching the bottle to the site. Without touching the bottle to the site. Okay, so I thought I saw something that said you're not supposed to touch the bottle to the dressing either. Remember I said the bottle is not sterile, but the dressing is sterile. So like, say you're packing a wound, the solution is sterile, the dressing is sterile, but the bottle is not sterile, so you don't want to touch the bottle to the dressing. When we read along further, I think it says that sterile solutions expire 24 hours after opening and recapping in some facilities. So I'm going to repeat that. Sterile solutions expire 24 hours after opening and recapping in some facilities. Other facilities state that once a sterile solution container is opened, it can be used only once and then thrown away. At my facility, I don't know about the 24-hour part, because I gotta be honest, I was looking at it from the lens of a CNA, not a nurse. Now I will be more aware when I'm watching these procedures being done to see if they, I know they save, like say you're packing a wound, they do save the, I think it's called is it Heavy Cleanse? Not sure. They do save the solution, but you know, they don't bring it from room to room or anything. But I don't know about the 24-hour part. I do know they do not discard it right away once it's open. Okay. Once the sterile field is set up, don sterile gloves. Sterile gloving. Let's go back to that. Once the sterile field is set up, don sterile gloves. Yeah, because you can't turn your back on the sterile field. You can't talk over sterile. You can't do nothing. You gotta stay like focused on the sterile field. You gotta be watching the client. You can't be just doing all this moving. So it makes sense to put your gloves on at this point. Sterile gloving includes opening the wrapper and handling only the outside of the wrapper. Don gloves by using the following steps. With the cuff side pointing toward the body. Okay, so I drew a little glove right here, y'all. So they're calling this. So this line here is how the glove is folded. I watched a video of this because I was confused about what they were referring to as the cuff. I'm over here stuttering a mug. Okay, so this is the cuff, this bottom area here. I thought, you know, like when you cuff your jeans, it's like a fold, so I thought that was the cuff, but no, I got clarification. All right, so with the cuff side pointing toward the body, use the non-dominant hand and pick up the dominant hand. So when you're putting on the glove, you see, ooh, holding this phone in my hand, a little stiff. So it's the pinky and it's the thumb right here. You gotta put your hand in like this. Okay? Said put your thumb in a little bit. Put your hand in. Okay. Use while picking up the edge of the cuff, pull the dominant glove onto the hand. with the sterile dominant gloved hand, place the fingers of the dominant hand inside the cuff of the non-dominant glove. So watch this. The cuff is referring to here, right? When you're doing the dominant hand. But when you're doing the non-dominant hand, so now you got this hand, right? That's going in. You got the gloves on. Now you're going in on the non-dominant. Right? Going in on the non-dominant. So there's gloves on this hand now, right? Sterile gloved. You're going to dig your hand inside this fold. And then you're going to have this hand like that to put in there. And you're going to work its way down. Because the whole glove is sterile until this part, this inner part starts touching your skin. It's no longer sterile. But you're taking the sterile glove, which is the outside of the glove, touching the outside of the other glove, and you're pushing it down on your arm, and you make sure not to touch your actual arm. Okay, but y'all go ahead and watch the videos, because I know, you know, this wouldn't be enough for me. Me just showing y'all my hands looking like a little puppet. Alright, when both hands are gloved, adjust the fingers. During that time, only a sterile gloved hand can touch the other sterile gloved hand. At the close, at the close, don't blame me, blame the English language, of the sterile procedure, or if the gloves tear, remove the gloves, of course. Take them off by grasping the outer part of one glove at the cuff area. I guess the same way you take off regular gloves. Avoid touching the wrists and pulling the glove down over the fingers and into the hand that is still gloved. Then place the ungloved hand inside the soiled glove and pull the glove off so that it's inside out and only the clean inside part is exposed. Oh, now it's clean, huh? It ain't sterile, but it's clean because your hands, you know, you didn't do all that aseptic scrubbing and all that. Okay. So, yeah, we got the little notes there. We got the little highlights to do my little pictures. I had to put the words and words that, because it was getting on my nerves, y'all. I can't. Then I drew a little diagram here. And then, now we over here. Oh, looking like Christmas. Just beginning to feel a lot like Christmas. And y'all, I Google stuff and define words. It's just easier to Google because I can just talk on Google. Google, what does phagocytic cell mean? Okay. An infection occurs when the absence of pathogen, when the presence of a pathogen, leads to a chain of events. All components of the chain must be present and intact for the infection to occur. So all the components must be present and intact for the infection to occur. Now, y'all, let me tell y'all something. I was over here reading like Homeboy from Reading Rainbow when I first started this video. No. This video, Reading Rainbow, I can do anything. Take a look in a book. Reading Rainbow. Listen, fatigue has set in. It's been a long day. So now, I'm about to talk like my little regular self. I'm sorry, y'all. I'm sorry. I hope y'all can follow along if y'all, continuing. Okay, all components of the chain must be present and intact for the infection to occur. You know what I'm saying? We need the causative agent. We need the mode of transmission. We need the portal of entry. We need the portal of exit. We need the susceptible. See, that's another one of them words that's too big for Elmo. Susceptible host. My tongue don't like that word. Okay. You don't know if you want to be an S or a C or what. Susceptible host. Where was I at? Causative agent. Mode of transmission. Oh my gosh. Damn. Hold on. We won't get this, y'all. There's 6 of them. Okay, that's my key. There is 6. And I'm going to get it. And I'm not going to get it in order. Causative agent. Mode of entry. No, portal of entry. Portal of exit. Motor transmission. Susceptible host. Okay, if we got one more, girl, you can do it. You can do it. What's the last one? Damn. I know this. I know it. Damn. There's one more. Oh, Reservoir. How did I forget that, y'all? Ooh, I forgot it. Oh my God. Oops. I was studying. I forget that, y'all. I forget it. I was studying. I got my same thing right here. I was studying. Oh my goodness. April. We're going to go over that in the morning. See, that's why we're doing this little video. Causative agent, reservoir, portal of entry, portal of exit, mode of transmission, susceptible host with like broken skin or immunocompromised. Look at it, oh, she's breaking it down. Immunocompromised. And it's funny because I had to do like little research on that, because reservoir and susceptible host, I was like, what is the difference? Like, you know what I'm saying? So I had a break. Ooh. Oh, whoa, focus. I had a breakdown. Reservoir normally lives. Reservoir is where the thing normally lives and multiplies. Y'all, but we ain't even there yet. Anyway, so types of pathogens. Pathogens are the microorganisms or microbes that cause infections. There are 5 types. I had to write that there. You know what I'm saying? Keywords for me. 5 types, April. Okay? Bacteria, viruses, fungi, prions, and parasites. Okay, y'all? That's for April. Pull out her her flashcards. Look, general feeling of discomfort, illness. Look at you, girl. Medical asepsis, bacteria. Oop. Are single-celled microorganisms lacking a nucleus that reproduce from every few minutes up to several weeks. Okay, and then bacteria continued. Multi-drug resistant organisms. Methicillin, MRSA. VRE. Yeah, whatever that says. And then the other one, C. diff. Bacteria. So these are my PowerPoints that I cut up and laminated them on some cardstock. Okay, the bacteria lack a nucleus, classified according to need for oxygen, shape, and gram staining. The shapes are cocci, round, bacilli, rod-shaped, spiral. Need for oxygen is aerobic and anaerobic. Aerobic needs oxygen. Think of aerobic like you at the gym doing aerobics. You need oxygen, you need to breathe. Anaerobic can grow only without oxygen. Okay. Yeah. This is how you study, y'all. Gotta pull out all of your tools. Contact caution. We are looking for prions. What are prions? Are protein particles that lack nucleic acids and are not inactivated by usual methods for destroying bacteria or viruses. So we want to put that. Okay. Y'all look at my infection chain that I drew. And I had the nerve to not remember reservoir. Shame, shame, shame. I don't want to go to Mexico no more. Viruses are extremely small and can be seen only with an electron microscope. Jesus. Fungi are tiny primitive organisms of the kingdom fungi that contain no chlorophyll. Yeah, example, yeast and molds. Jesus, I couldn't read my own handwriting, y'all. They feed on living plants, animals, and decaying organic material. They thrive in warm, moist environments, reproduce by spores. In humans, fungal infections are called mycosis. Debris. Okay, I got parasites. All right, y'all. Okay. Virulence is the ability of a pathogen to invade and injure a host. Virulence sounds violent. The ability of a pathogen to invade and injure a host. Herpes zoster is a common viral infection that erupts years after exposure to chickenpox and invades a specific nerve tract. I need to Google what nerve tract that is. I'm curious. Okay. Immune defenses, non-specific, innate, natural, early line of defense. Native immunity, natural immunity, same thing. So it's an early line of defense. Restricts entry or immediately responds to a foreign organism, antigen, through the activation of phagocytic cells. Complement. Okay, whatever. I gotta talk to the teacher about that, because complement and inflammation. This occurs with all microorganisms, regardless of previous exposures. Now, passive are antibodies from another person or animal. Antibodies are produced by an external source. Keyword external source. Temporary immunity that does not have memory of past exposures, because there wasn't any. You got it from someone else. It's like artificial. Intact skin, the body's first line of defense. Mucous membranes, secretions, enzymes, phagocytic cells, and protective proteins. Now anyway, phagocytic cell, type of cell that has the ability to sometimes digest, foreign particles such as bacteria, carbon, dust, or dye. And protective proteins. Inflammatory response with phagocytic cells. The complement system. And interferons to localize the invasion and prevent its spread. So I put interferon down here, a protein released by animal cells, usually in response to the entry of a virus, which has the property of inhibiting virus replication. Okay, specific adaptive immunity allows the body to make antibodies in response to a foreign organism, antigen. This reaction directs against an identifiable microorganism. Active antibodies are produced in response to an antigen. They require time to react to antigens. They provide permanent immunity, involves B and T lymphocytes. So B cells, or B lymphocytes, attack invading toxins. And then T lymphocytes, or T cells, attack body's contaminated cells. Just the little notes put there. Okay, produces specific antibodies against specific antigens. I started to break down what the these meant, but it's just immunoglobulins A, immunoglobulin D, E, G, and M. And they are passed in the colostrum, that thick milk that comes out the mom, the first milk that they say is very important when you're breastfeeding your baby. It's passed in that from mother to the baby. That is literally like breast milk is, a little thinner than that. Okay, it's more like 1% milk. That's like, I don't know. That's like oat milk with smokes in it. Okay. Infection process. Chain of infection. Causative agent. Bacteria, virus, fungus, prion, parasite. And then I put causative agent. I put thing that caused the infection. Then reservoir. Human, animal, food, organic matter on inanimate surfaces, water, soil, insects. And then I put where the infection normally lives and multiplies. Okay, and then inanimate reservoir is people. Animate reservoir. People, insects, birds, other animals. Inanimate reservoir is soil, water, food, feces, equipment, and intravenous fluid. Portal of exit. That means that it leaves the host. Respiratory tract, droplet, airborne, mycobacterium, tuberculosis. I'm not saying that one right now. Gastrointestinal tract, genitourinary tract, E. coli, hepatitis A, HSV, HIV, then skin, mucous membranes, HSV and varicella, blood, body fluids, HIV and hepatitis B and C, transplacental, Jesus, my brain was about to say something totally different. Oh gosh. Okay, mode of transmission. Contact, direct physical contact, person to person, indirect contact with an inanimate object, object to person, fecal oral transmission. Oh, I'm about to say what? And I was like, that's nasty. But yeah, like when, oh gosh, kitchen workers don't wash their hands. You're talking about they cooking your food. Handling food after using a restroom and failing to wash hands. No, that's not failing. Y'all just nasty. Like, anyway. Droplet, sneezing, coughing, and talking. Airborne, sneezing and coughing. Vector-borne, animals or insects as intermediaries. Ticks, transit, Lyme disease. Oh my God, Jesus, I'm so tired. Ticks transmit. I'm like, what? Transit Lyme disease? Ticks transmit Lyme disease. We know that. Mosquitoes transmit West Nile and malaria. You also know that. Portal of entry to the host might be the same as portal of exit. Successful. Oh my God, Jesus. Tell me I'm tired without telling me I'm tired. Susceptible host. Comprised. Oh my God. April, slow down. Compromised defense mechanisms. Immunocompromised breaks in skin, leaving the host more susceptible to infections. Got a long way to go. Let me try to speed this up, y'all. I'm just going to do the highlighted areas because y'all see your girl tired and take a shower, go to bed. Tired. Okay? Stages of infection. Incubation. Interval between the pathogen entering the body and the presentation of the first finding. prodromal stage, interval from onset of general findings to more distinct findings. During this time, the pathogen multiplies. Illness stage, interval when findings specific to the infection occur. Convalescence, interval when acute findings disappear. Total recovery taking days to months. Assessment, data collection, yeah, we over that. Okay, so decreased vascularity is uniformly small size of the pulmonary vessels at the hilia and within the lungs, because it's talking about the older adults. Can have slowed response to antibiotic therapy, slow immune response, loss of subcutaneous tissue, and thinning of the skin, decreased vascularity. So I had to Google that because I was not sure what that was. So I put myself a little note there, and then I put the matching highlight to go with that. And then diaphoresis. Yeah, I didn't know what that was for a little bit. I thought I knew what it was. Double checked, and I was wrong. So diaphoresis is sweating. So I highlighted it there, matched it there. And then I put a little note here because it was talking about expecting findings. So let me read this to you. Does this sound right? I had to break it down because I was like, whoa, what's going on? Findings identifiable in the nursing assessment of generalized or systemic infection include the following. Like, that sounds like a run-on sentence. It's making my head spin, so I had to break that down. So, fever, presence of chills, which occur when temperature is rising, and diaphoresis, which occurs when temperature is decreasing. So I was confused. I was like, y'all, let me tell you, I was confused. I said, oh, hold on, girl, you confused. You need to write down a little key because you confused. I got confused. I had to like, girl, think like a nurse, think like a nurse. Okay, act like a lady, think like a nurse, girl. So, presence of chills, which occur when temperature is rising. So, I had to tell myself, chills and heat. Temperature is rising, it's getting hotter. I was getting confused, I was getting tired. And then diaphoresis, once I looked that up, sweating, which occurs when temperature is decreasing. I was like, how the hell are they sweating when temperature decreasing? Don't it mean it's getting cooler? I said, yeah, April, that's the problem. Y'all ain't shot me my own little study buddy, girl. So I had to put sweating in cooler air and chills in heat, boo-boo, because I was getting all cross-eyed and confused. Okay. And then malaise is discomfort. I had to put that. I knew what it was, then I forgot what it was. So it's called studying, y'all. Study. Might have an advanced infection. An older adult might have an advanced infection before it is identified. That means it might be advanced. Key is advanced. Atypical findings, agitation, confusion, or incontinence can be the only manifestations. Other findings can vary depending on the site of the infection. Purulent. Y'all, we went over this word. The teacher was saying it. We thought she was saying purulent. I was like, so indicates large numbers of white blood cells and then pus. Purulent sputum and cackles in the lung fields, dysuria. I had to write dysuria. Was it dysuria? Nah, it was phasia. I was like, whoa, hold on. There's too many phasias at once. So I can't read my own handwriting right now. Adenophagia. I think I'm saying that right. Adenophagia. Painful swallowing. So I'm like dysphagia, difficulty swallowing. So I wrote the definitions of these two to differentiate them. Quickly differentiate as I'm looking at them. So that word there that y'all see, hyperemia, an excess of blood in the vessels supplying an organ. And then nuchal, rigidity, stiff neck. I was like, dang, y'all couldn't just say stiff neck. I mean, dang. Anyway, then y'all, this word here, this little Spanish word here, sanguíneas. I had to listen. I said, Google, how do you pronounce this? I'm good at pronunciation of words, y'all. I swear I am. When I ain't so tired, I said, Google, how do you pronounce that? And it broke it down, and I wrote exactly how Google broke it down. All right, in the third stage, damaged tissue is replaced by scar tissue. Okay, let's see. Okay, so y'all, we's talking about where we at. Where's gallium skin? I think that is here. See, this is why I highlight and then highlight the match it, because now I'm looking for gallium skin and I don't see it. I didn't know what the heck it was, so I said, Google that, girl. What is that? Differential elevator erythrocyte sedimentation rate over indicates presence. Nope, it's not there. All right. Oh, okay. Gallium scan, nuclear scan that uses radioactive substance to identify hotspots of, yeah. So so for gallium scan, it says nuclear scan that uses radioactive substance to identify hotspots of white blood cells, right? That wasn't enough of an explanation for me. I wanted to envision what the heck is going on. So Google, help me. Gallium scan. A day or two before you scan, your healthcare provider injects the gallium citrate into a vein in your arm. The gallium then travels all over your body. A special camera will scan your body with the aid of the gamma rays from the gallium. See? Ain't that better? More, you got an idea what's going on versus this little... Have you lost? Use frequent and effective hand hygiene before and after care. Educate the client, ask for a return demonstration of good oral hygiene. Good oral hygiene decreases the protein which attracts, down here, y'all, microorganisms in the oral cavity, which thereby decreases the growth of microorganisms that can migrate through the breaks in the oral mucosa. Brush y'all teeth, y'all. It's important. Encourage the client to consume an adequate amount of fluids. Adequate fluid intake prevents the stasis of urine. So, stasis of urine. Yeah, I was trying to figure it out. I was thinking of homeostasis. It wasn't coming to me, so I had to Google that. So, stasis of urine equals stopping of urine. So, boom. I don't like to pretend I know what something means, and I don't want to be lost. And sometimes you think you know, and then you are totally wrong. By flushing the urinary tract and decreasing the growth of microorganisms, adequate hydration also keeps the skin from breaking down. Intact skin prevents microorganisms from entering the body. Pretty much, keeps you moist and supple. You know what I'm saying? If you water on this part of your skin ain't too good, too much, getting dry and ashy, and that's another skin breakdown. It could cause cracks in your skin. Got to stay with the lotion. Okay, for immobile clients, ensure that pulmonary hygiene, turning, you got to have these people cough like they're having issues, like cough because their cilia and all that area, and it's helping to move the mucus up and get all the stuff out. You know what I'm saying? Deep breathing, that's also moving things. And then incentive spirometry. See how I did that, y'all? Okay, and that is, I put here, blowing the ball. I see the clients doing that a lot. Is done every 2 hours or as prescribed. Good pulmonary hygiene decreases the growth of microorganisms and development of pneumonia by preventing stasis, aka stopping, of the pulmonary excretions, stimulating ciliary movement and clearance, and expanding the lungs. Technique and proper teach and use. Okay, so rhinorrhea. I guess I could have figured out that meant runny nose. I wasn't 100% sure, so I Googled it. Yup, runny nose. It's like runny booty, runny nose. Yeah. Okay, imagine if we was really study buddies, y'all. Y'all crazy and I say crazy things. Keeping it crazy. Okay. Change personal protective equipment after contact with each client and between procedures with the same client if in contact with large amounts of blood and body fluids. Clients in isolation are a higher risk for depression and loneliness. Yeah. Assist the client and their family to understand the reason for isolation and provide sensory stimulation. Standard precautions, tier 1. This tier of standard precautions applies to all body fluids except sweat, non-intact skin, and mucous membranes. A nurse should implement standard precautions for all clients. Hand hygiene using the alcohol-based waterless product. Yeah, I wash my hands all the time, even though it's funny because this book says that using the hand sanitizer, if your hands are not visibly soiled with body fluids and stuff, is actually better than washing your hands because, alcohol kills the bacteria versus, I guess we could miss a spot if we wash our hands. I ain't missing no spot because this job is nasty. So you be thinking, what did I just touch? And you wash your hands. But whatever. I'll show y'all that somewhere in here if y'all don't believe me. Alcohol-based waterless antiseptic is there you go, see? Is preferred. Y'all see that word preferred right there? Unless the hands are visibly dirty because the alcohol-based product is more effective in removing microorganisms. See? So we was doing a thing in class today and somebody said that and I was like, what? Nah. Hand washing is the number one effective way to, the thing they be saying. So we was doing like a little game online. And the right answer was this. I was like, what? It's right there in black and white and a little bit of yellow because, I highlighted it, but, So it's preferred to, it's not like to wash my hands. I don't know. And it's always ever changing because, the things I've been at CNA for 17 years, the things I used to get in trouble for. And then now they're like, they done changed up the rules. And I'm like, wait a minute, I used to get in trouble for this, not doing this. And now, it done changed. It's like, it feels so crazy. But anyway. Hand hygiene using non-antimicrobial soap or an antimicrobial soap and water is recommended when visibly soiled or contaminated with blood or body fluids. Use soap and water, not alcohol, for C. diff. So, y'all, see how confusing that is? Yeah, just wash your hands all the time. Wash good, okay? Just always feel like you got C. diff on your hand. You don't know if people got C. diff or not until you start smelling stuff. You're like, oh, I think they got C. diff. But anyway, masks, eye protection, and face shields are required when care might cause splashing or spraying of body fluids. Hand hygiene is required after removal of the gown. Use a sturdy, moisture-resistant. Wait a minute. Oh, so now you're gonna talk about moisture-resistant, but before it was non-waterproof and all this. Listen. Y'all. Okay. Properly clean all equipment for client care. Dispose of one-time use items according to facility policy. A client does not need a private room unless they are unable to maintain appropriate hygienic practices. Airborne precautions require a private room, mask and respiratory protection devices for caregivers and visitors. Use an N95 or high efficiency particulate respirator. The client is known or suspected to have tuberculosis. Negative pressure airflow exchange in a room of at least 6 to 12 exchanges per hour. Clients who have an airborne infection should wear a mask while outside of the room. Example, C19. Droplet. I googled that to make sure. Droplet precautions. Droplet precautions protect against droplets larger than 5 mcgs. I don't even know what the hell that means. That sounds like math to me. And travel 3 to 6 feet from the client. A private room or room with other clients who have the same infectious disease. Ensure that clients have their own equipment. Duh. Clients who have a droplet infection should wear a mask while outside of the room or home. AII room is airborne infections isolation room. Have negative pressure relative to other parts of the facility. Negative pressure causes air to flow from the corridors into the AII room. Air cannot escape when the door is closed and ventilation is working properly. Contact precautions. Protect visitors and caregivers when they are within 3 feet of the client against direct client and environmental contact infections. Require a private room or a room with other clients who have the same infection. Gloves and gowns worn by the caregivers and visitors. Disposal of infectious dressing material into a single non-porous bag without touching the outsides of the bag. Protective environment. Protective environment is an intervention, not type of precautions, to protect clients who are immunocompromised. I gotta repeat that. Protective environment is an intervention, not a type of precaution, to protect clients who are immunocompromised. This includes clients who have had an allogenic hematopoietic, stem cell. I think I slaughtered that word. Cell transplant. Oh Lord, I'm tired, y'all. Okay. A protective environment requires a private room, positive airflow, 12 or more air exchanges an hour, HEPA filtration for incoming air, mask for the client when out of the room, medications, antipyretics. Antipyretic, acetaminophen, and aspirin are used for fever and discomfort as prescribed. Nursing actions: monitor fever to determine effectiveness of medication. Document the client's temperature fluctuations on a medical record for trending. Antimicrobial therapy. Antimicrobial therapy kills or inhibits the growth of microorganisms. Antimicrobial medications either kill pathogens or prevent their growth. Give helmintics or for worm infestations. Maintain a medication schedule to ensure consistent therapeutic blood levels of the antibiotic. Interprofessional care, transporting a client. If movement of the client to another area of the facility is unavoidable, the nurse takes precautions to ensure that the environment is not contaminated. For example, a surgical mask is placed on a client who has an airborne or droplet infection, and a draining wound is well covered. Reporting communicable diseases. A complete list of reportable diseases in the reporting system are available through the Centers for Disease Control and Prevention's website, www.cdc.gov. There are more than 60 communicable diseases that must be reported to the Public Health Department. Like I said, numbers, I gotta repeat, because I will forget. They are reported to ensure appropriate medical treatment of diseases such as tuberculosis, monitor for common source outbreaks, foodborne or hepatitis A, plan and evaluate control and prevention plans, immunizations for preventable diseases, identify outbreaks. I told these children I'm studying, right? And epidemics. Determine public health priorities based on trends. Client education. Teach the client about any infection control measures at home, self-administration and medication therapy, complications to report immediately. And y'all, Thank you for studying with me. Your girl needs a nap. Bye-bye.